Welcome back, everyone. If you've ever gone to the emergency room for something minor and walked out with a bill large enough to freeze your entire week, this video is going to save you money and stress. Just a quick note before we start, I'm not a physician. This is not medical advice. This video is meant to educate you on how the health system works and the different levels of service that these facilities can provide, especially when it comes to cost and access. So today I'm breaking down the emergency room versus urgent care versus primary care and even telehealth. I'll show you when to use each one and how choosing the wrong place can cost you hundreds or even thousands of dollars. And if you watched my last video on what a patient advocate really does, this is the perfect follow-up. So let's get into it. When in doubt about your safety, you go to the emergency room. No hesitation. The ER is for things such as chest pain, difficulty breathing, any stroke symptoms, uncontrollable bleeding, major trauma or injuries, severe abdominal pain, and head injuries. These situations are emergencies, and the ER is absolutely the right option. But here's what people don't realize about the ER. They charge facility fees, provider fees, testing fees, and all of these things add up really quickly. That's why something really simple that might cost you $100 at the urgent care can turn into $2,000 or $4,000 in the emergency room. The ER is for emergencies, not for convenience. I saw so many patients when I worked in the freestanding ER doing patient registration that went there for things that were very minor and could have been treated easily at the urgent care or the primary care, and it would have saved them so much money. Urgent care is the middle ground. It's faster, convenient, and typically much more affordable. Urgent care is good for things like common cold, COVID symptoms, UTIs, ear infections, rashes, sprains or minor fractures, minor cuts that need stitches, vomiting, dehydration. Most urgent cares today offer x-rays, basic lab work, IV fluids, and rapid testing. It is important to note, though, that not all facilities on the urgent care level are created equally. Some of them have less staff than others. Some of them offer less in-house services than others. So there are some things that aren't found at every urgent care. So just keep that in mind. You can always call ahead if you need to know if they provide x-rays or something like that. The typical cost for most insured patients for an urgent care visit ranges between $80 to $200, which is a big difference compared to going to the emergency room. The next option is your primary care physician or your doctor's office. Primary care is the option that is sometimes overlooked, but it's definitely one of the most important. Your primary care doctor is best for managing chronic conditions like diabetes, blood pressure, asthma. They can provide medication refills. They can help you manage your anxiety or depression, help with managing long-term pain. They also provide preventative care, which is really important. And they can also give you referrals to specialists if you need to be referred out to another physician. They also do follow-ups with you after you have an urgent care visit or an emergency room visit to check on you and make sure they're up to date on your most recent medical changes. It's also normally the cheapest option, often between $0 to $50 depending on your insurance, but it's not always the fastest option. Another option that's become more popular since the start of the pandemic is telehealth. So telehealth is one of the sometimes more underused tools in healthcare, especially during wintertime. It's great for if you have certain like cold, flu symptoms, coughing, things like that, some sort of allergies, pink eye, maybe you have a rash. If you require certain medication refills, they also often provide mental health check-ins. They can answer follow-up questions, review some of your test results, and even help you decide where to go next, wherever you're at. So most telehealth visits range between $0 to $40, and many insurance plans include that for free. I know my insurance does, which is really nice. I take advantage of it quite often. Here's the key. Telehealth providers can help triage your symptoms over the phone at the click of a button and tell you whether you need to go to urgent care or ER. So this will help save you time, money, and unnecessary exposure. So let's break down the difference in some of these prices. Some of these general prices. They won't be the same at every facility, of course. But let's see how the location alone can change the cost. For instance, strep throat. If you go to the emergency room for that, you could pay around $1,200 or more. If you go to the urgent care to be treated for strep throat, it could cost between $80 to $150, whereas if you go to your primary care, it could range between $25 to $100. Same problem, different door, a very different price tag. So let's break down a sort of decision guide. Here's an easy way to decide where to go. Could this be life-threatening? If the answer is yes, go to the ER. Do I need care today? Maybe you need to go to the urgent care. Is this an ongoing or chronic issue that needs to be managed on a regular basis? You need to see your primary care physician. You're not really sure where to go from here. If you're established with a primary care physician, call them and they can always give you direction. Or if you're not sure, you can also try telehealth as a first step. Let's talk about some insurance traps. So here's why people lose money without even realizing it. The ER visits can trigger facility fees. Out-of-network ER doctors can bill you even when you're in network with your hospital. Observation versus inpatient status can change your bills drastically. Urgent care is billed as outpatient. Primary care is often considered preventative or office visit pricing. This is why navigating healthcare can feel so overwhelming. There's so many layers to all of these things. If this already feels confusing, or if you've gotten a bill that doesn't make sense, go watch my video on what a patient advocate really does, and I can link it below. Healthcare is stressful enough without financial surprises. Knowing where to go, the emergency room, urgent care, primary care, or even telehealth, can save you time, money, and a lot of stress. If this helped you, like my video, subscribe, and share it with somebody who also wants to learn more about healthcare. Stay warm and stay informed, and I'll see you in my next video. Thanks for watching. Bye-bye.